All right, everybody. For those of you, oh, trying to get this off of my phone here. All right, for those of you who do not know, Justice and Beyond has been organizing now for about 9 years, where we are making sure that we do our best to uplift and amplify the voices of Brown and Black people within our community. We always want to be led by Black voices because we think that that's important. It's also important to have allies in that work that we do. We also think that it's important to make sure that we focus our work and frame it in certain areas. And those areas are criminal justice, education, health and environment, and housing. And so we always want to present forums to educate people and to call them into action so that we can bring change in those specific areas. And so we're operated and we are governing ourselves as Justice and Beyond with what we call our pillar system. So our pillar order of governance is that we have different organizations and sometimes individuals sign up to say that they want to be a part of the planning and the vision casting of Justice and Beyond. I say that to say that we need more pillars. We need more people to come along and say, I will dedicate my time in making sure that we put together good programs that are going to educate people and call them to action with Justice and Beyond. And so you can do that mainly by giving an hour and a half of your time on Tuesdays at noon to join us on the same Zoom link and saying, I will be committed to helping with the work of Justice and Beyond so that we can continue to call for change and to make a better world for all of us, fighting for justice and dismantling racism. So as we come to do that tonight, again, I welcome each of you here tonight. We're glad that you're here. Our discussion is around maternal health and the inequities that are in this system. And so I am very pleased to welcome my dear friend, Ms. Barbra Majors, to be the moderator of this discussion tonight. And I'm going to hand it over to you, Ms. Barbra, so that you can introduce and allow your panelists to introduce themselves. And I'll just leave it in y'all's hands until we get to the question time.
Thank you, Pastor Manning. Good afternoon, everybody. And it's always good to see faces I've known for a long time and to meet new faces, particularly in any part of the movement for equity and social justice. Tonight's conversation is, vital. It's like all these conversations. This conversation is personal because I'm a woman, because like so many of us has lost somebody close in the whole process of childbirth. And I think we've taken maternal health kind of for granted in this country. Like it's all okay. Having a baby is nah, it's deeper than that. And we have two amazing young women here tonight who are about the business of making sure that folk understands that Black mamas matter. And so I am really appreciative of you all being here and we're going to lay out some statistics, but I would like for you all to introduce yourselves. And that's Dr. Victoria Williams. And I saw, there she is. Hey, Frankie and Amandla. I love the name of your group, sister. I'm just saying, but would like for you all to introduce yourselves and say a little bit about what you do, in particularly reference to the issue that we're talking about tonight. And I'll start with you, Dr. Victoria Williams. Welcome. And I'd like to say thank y'all for what you're doing.
Thank you for having us. I am Victoria Williams, and I am a recent recipient of a doctorate degree in healthcare administration. And I am a maternal child health consultant, doula, lactation consultant, social worker by training. Everything I do is social work. So I am a social worker. And I'm a mother of 3 girls.
Oh, wow. Well, welcome.
Thank you so much.
Frankie, Robertson. I'm gonna pronounce it right. If I get people's names, it's charge it to me head, not my heart. But I'm real particular about making sure I say people's names correctly.
I appreciate that. And thank you. My name is Frankie Robertson, and I'm the founder and president of the Maternal Group. It's a social justice consulting firm focused on addressing the social, political, and structural determinants of health that impact the overall health of Black and brown birthing people. I'm a lobbyist, so through my firm, I offer advocacy and direct lobbying services, communication, community-based communication, meaning public education, research, strategy, all designed to address or tackle health disparities for Black maternal health and our sisters and brothers who are also experiencing this disparity. Also founder and doula with Black Joy Doulas. My focus is supporting people through their pregnancy journey with high-risk pregnancies and specifically families who find themselves experiencing the NICU journey. My passion is mental health, and I'm so happy to be here today serving along someone I admire, who I consider a friend and a mentor, Dr. Victoria Williams.
I love you, Frankie. I forgot to even talk about where I work. I'm so sorry. I work for Birthmark Doula Collective, and we are a reproductive justice organization here in New Orleans. I don't know if Frankie told you guys, but she's in Baton Rouge. So thank you so much for being here. And she's doing amazing work up in Baton Rouge. And we often get to visit each other on the Capitol steps, which we did for Maternal Health Week last week. So yeah.
Well,
and I'm a
we
huge
welcome
fan of Birthmark Doula Collective, so I am always singing their praises. So a huge fan.
Excellent. And look, and we're talking. We won't just be talking medical because we're also going to speak about the social and economic determinants of these outcomes. So there may be terms, and I always like to say to folks, it's all right to ask for a literacy moment because I might ask for one myself. You know, because a lot of us here, we care about this issue and we'll sit and go like, yeah. We'll know what the hell you talking about. You know what I'm saying? So if folk got, like need a literacy moment, feel okay to raise your hand. Or in fact, Arissa, you're kind of they can come to you, right? If there's something or a question for clarity, because we want to make sure that we break this down as simply as we possibly can to not only talk about the problem, but also what we can do. One of the things that, and Brooke, I appreciated that you had put up some data earlier, and I would really like for you to put that data up. And one of the things that you said is like, you go to different places, you will find different data in terms of outcomes for Black and brown women. However, I don't care where you go to research the data, it's gonna be bad. The outcomes are gonna be seriously sad in terms of the outcomes for women, for Black women, and for brown women as well. So I don't know if Brooke, if you were there, if you could put those numbers back up for us.
And Ms. Barbara, before we jump in with those numbers, I really want to give what I like to call a trigger warning, just to allow people to the space and the time to, if there is something here that we're talking about that is, we know that is very personal for a lot of families. Right. Take space, take the time you need to get up, move about, move your body as we talk about this. You may have an emotional reaction. Your body may be telling you that, what we're talking about is touching or is painful. I challenge you to take breaths and put your hand in your heart and just kind of breathe through it, because it could be tough. We talk about this stuff every day, and we work through it a lot, but I can tell you that second and third people trauma is a lot. So
I appreciate that so much.
Awesome,
I really do. Tell folks, because I'm going to tell you something. Dealing with racism, I always tell people, you got to protect your mind, your body, and your spirit, because this stuff comes at you all the time. So thank you so much for lifting that up. Thank you, Doc. We're just to look at just a brief look. And this just a little snippet, y'all, just the data. Brooke, can you put it back up? I think it was Brooke, right? That had it up there. Yeah, thanks, Betty. Where's Brooke though? you know, y'all in these little boxes. Sometimes it's hard for me. Do I still have Brooke? Is Brooke still here?
I think she was having trouble sharing.
Oh, okay. Well, I can read them off, you know, so I don't know if you remember them, but like I said, the numbers are staggering. And these numbers are like out of 100,000 births, 173 of the richest white infants died. 350 of the poorest white infants died. 437 of the richest Black infants died, and 653 of the poorest Black infants died. So this stuff doesn't care if you were educated, if you rich, if you Black, the risks are just so much higher. And I want to ask both of you, and you can respond in your own way. Thank you, Brooke. That they're the numbers if you want to take pictures of them or whatever. But it's like the information is kind of now, it's, you know, people are paying attention to it. It's kind of there. But you answer in your own way. Do you think racism is the primary cause of the difference in these outcomes? I'm gonna go to you first, Frankie.
Absolutely, beyond a shadow of a doubt. And when people think of racism, you think of racism. Some people think of it differently. Sometimes those of us who are familiar with racism in the different forms have a keen understanding of racism. You would be surprised at how many people don't really know what racism is. They think racism is, I was attacked by the Ku Klux Klan, or I'm a member of the Klan, or I use the N-word, or different types of things that people categorize as racism. And there's a lack of understanding what racism is. So some people understand that there's interpersonal racism, which I think that's the one that most people want to identify with as not being racist or understand racist encounters, but it's things like structural racism, right? Institutionalized racism, systemic racism that's driving these numbers, right? It's everything from interpersonal racism, implicit bias, explicit bias, which at the heart of that is racism, right? To lack of access and equity based upon systemic and structural racism that's baked into our everything in this country in terms of access to housing, access to healthy foods, access to equal income for people of color, and then Black women in particular, Latinx communities, or Latinx women, racism in terms of the quality of air that you breathe, right? Mm-hmm. Racism in terms of gendered racism, the intersectionality of being a Black and a Black woman and a Black person, a woman and a Black person, right? Which is something that Dr. Fleda Mass Jackson talks a lot about in her research, and I'll credit that research to her. So when you look at all of those issues and how they impact us as Black people, how can we not assume that they won't impact us as pregnant Black people, right? And our infants, because the health of the child is connected to the health of the mother. And that's just from that particular side. We're not even talking about treatment and bias and racism and differential care that we experience once we're in the medical institutions that determine how much effort a neonatologist may give to a struggling Black infant, or what types of hospital resources from like human donor milk and things like that that may be life-saving for a hospitalized preterm infant. Because as Black people, we do have the higher preterm birth rates, and we do know that prematurity is the leading cause of death in the first month of life. So I know that's a loaded answer, but that's just the 50,000 level answer there.
Well, Lord, hey,
yeah, beyond a shadow of a doubt. Yeah, racism in its many forms.
Victoria.
Well, I'll just speak to the fact that, as Frankie highlighted, that racism is a part of it. There are other social determinants of health which we strive to try to alleviate through our policy work. Poverty, lack of access to healthcare, environmental factors that are all super significant when it comes to the health and the well-being of Black and brown people in New Orleans, specifically across Louisiana, really, because we know that Shreveport and Monroe have some of the worst birth outcomes in the entire state. And it's just sad that we kind of drill down on the biggest numbers, but when you look at rural areas and the number of people that they're losing over time, then you begin to see a diminishing of a culture that was built way before we understood what was there. So I think that's an important factor in this racism understanding.
And I guess the part of that same question is, even when we look at the social determinants, are they fueled by racism as well?
Yeah, definitely. You
know, the poverty. Yeah, so racism is kind of
start out being racist, right?
It's just kind of the foundation. Okay.
Exactly. Yeah,
the foundation. Yes.
Yeah, it's the foundation.
When you're thinking about the obstetric system, right? It's a system. There's a foundation of racism that was built in this system from the institution of the obstetrics division, how it came about. How did we get OBs? They were white men who decided that these midwives and, they couldn't control the women. We were hollering and screaming, all doing pregnancy and birth. And they're like, we need to control these people. And so you had this wave of the Good Old Boys Club, or, that's how we get all these names. And a lot of times we don't know where they come from until you do the research and find out, oh, it came from our other people, our other comrades. They were trying to make their own systems and abolish some of the things that's historic. I mean, midwifery is historic in the Black community.
It's interesting, the relationship, is you talk about these old white men dealing with women's bodies. It's the same dynamic going on now in terms of access to reproductive health. You know what I'm saying? And that feeds into a lot of these disparities that's happening in maternal and child health. Now, the data also shows, and I'd like for you all to speak to it and why you think so, that when Black women have Black OBGYNs or whatever, they fare out better. Why do you think that is? I'll start with you, Victoria. Why do you think that is?
Because it's understood that when Black women and Black OBs are there, you have better outcomes. Even when having a Black team, imagine the power of a Black team, meaning your doula, your lactation consultant. But once again, these are areas which is burdened by disparities, areas where Black women are not, or Black people, period, are not often, we can't afford to be all medical providers, right? We can't afford to be, go to 8 years to be a doctor, or just not a field that's heavily pursued after for Black women. I mean, there's a new wave of, I think it's 1,000 white coats, where it's a new wave of Black young people who are changing that narrative for everyone. We definitely appreciate that. We have other organizations who are willing and offering to show, to provide scholarships for lactation consultants, because we know even with breastfeeding outcomes, if you have a Black lactation consultant, you have better outcomes in breastfeeding. Just so simple as that.
Yeah, and the impact it has. Frankie.
I mean, I think it's, it's not a surprise that those outcomes are the way they are when you just look at being able to access or provide culturally competent care. When you have similar lived experiences and certain familiarity with situations and with people, then you just have a better understanding. There's less bias there. I'll say less because you are skin folk, as it may make it backwards, doesn't mean you are kinfolk. There are individuals who may subscribe to this racially biased institution and how it views Black people and how it views people based upon economic disadvantage, or economic injustices, right? And maybe so subscribe to this system that, they are just well into the system and provide that same lack of proper care. But I think statistically, right, that care is not going to come from African-American, doctors and having to unlearn that. But we have to be careful not to subscribe to the institution itself and how it places less value on Black Americans, right? Black people.
Right.
But just that familiarity with, culturally, just understanding how we feel, understanding our lived experiences, but then understanding our lived experiences in terms of how those lived experiences and societal things impact us in our pregnancy. Understanding that if I'm a pregnant person and I was at my doctor the day after George Floyd was killed, right? I'm likely in a different mental state than maybe your white patient who may be totally disconnected to this experience. So my blood pressure might be high, or I may be feeling distressed and things like that. That's important for you to know, so you know how to treat me, right? To be able to be in tune to the things that I'm not just going home to decorate my nursery as if nothing, ever happened, because I'm not in tune to this. I'm totally impacted, and not to mention if I'm a Black mom who has a Black son who is watching this, we're talking about a whole different level of awareness and understanding and stressors that really get under your skin, that trigger things that could negatively impact your health, and by that impact your pregnancy outcomes, as well. So those things are important. And then just how you value, your patients based upon how you want to be treated and how you may have been treated as a human. So you are perhaps more in tune to the type of care that you provide, because chances are you've experienced it, or you experience it when you're not in your lab coat or as a doctor, when you're just navigating through the world as a Black person.
Yeah, and both of you brought out the fact that it's not just the doctor, but across the board, everybody who's interacting with that mom, you know what I'm saying, that baby, it's like, yeah, you can't.
That's so true.
Yeah, it can't. It's from she walked into the building for her appointment. The first person, I don't care if it's the receptionist or whomever, but everybody, it's like everybody got to understand that there's some differences here that need to be addressed and dealt with.
That's such a great point. If I could say, excuse me, that's such a great point, because, a lot of emphasis is placed on the physician, but you statistically spend more time with everybody else, right?
Exactly.
Whether it's the person you're scheduling the appointment with from when you call, and oftentimes, through me, supporting loved ones and family members through their journey, or just calling just for a new appointment in general in the medical community, not speaking of my OBGYN office, but just calling in a new patient. The other day I called in for, to get a standard procedure. And the first thing someone asked me, and it wasn't even a nice manner, what type of insurance do you have?
Yeah.
Like, such and such. I said, why? Well, because we don't take Medicaid. And just that type of exchange is enough to just get your blood boiling before you even have your appointment.
Right.
And so I'll just stop there. So it is the whole team.
It is.
Honestly, a lot of times it's from what I've experienced, and then what I've heard other people relay to me through their experiences. It's really that nursing team that a lot of people have the most grievances with, right? And understanding the levels of hierarchy, how to contact the charge nurse to report certain things or ask for someone else. It's really outside of the physician themselves that it's a whole team of people.
Right. Is there, and maybe, is there a way, because one of the things that I've noticed just in terms of, and I've noticed I'm more attentive to it now because of personal experience, but I'm finding that too many of Black people don't realize that they have the right to question or to not accept. And so when we start looking at proposals for how do we make it better, one of the things I would put on the list is folk learning how to be their own advocate, knowing that they have a right to be their own advocate in this healthcare industry, because that's what it is. It's an industry. You know what I'm saying? Yeah. And technology. The other thing is technology. Like, I'm a nonviolent woman. That's because Pastor Manning's in one of these little boxes. But I was trying to get through a portal. You know, like when you got to access your health care through the portal, to make you want to punch somebody in the throat. You know what I'm saying? It's like you got to go through all of this stuff to access your information. So you're absolutely right. There's a great book that says racism makes your blood boil. I mean, in terms of blood pressure, it just does. And when you already you're pregnant and you're stressed because nobody know all the other stuff that's going on. Do you see any difference, or what would be? Go ahead. I'm sorry, Victoria. Go ahead.
I was going to just say, not even just thinking about how we have anxiety and depression and how all of that looks different in the Black community and amongst Black and brown women. So yeah, this is just right. It does a lot more than make your blood boil with the increase in cortisol. Then you have, more obesity because our cortisol is so high from stress. So it's a lot. It's very, it's in depth.
You summed it up. It's a lot. Both of you, do you see what's the difference between like home birth versus hospital? Is it?
So the reason why a lot of people are choosing home births right now and transitioning from hospital to home is because of course, the outrage of Black women who want a different experience. They want to have their own team. They want to be in the comforts of their home. They don't want to be discriminated against because they have Medicaid or because their partner is of the opposite sex, or because just an array of things. They don't want to be discriminated against, and they want to have a more controlled environment. I remember my OB told me I was controlling because I wanted to have my birth a certain way, and it's okay. It is your right as an individual to birth the way you want to birth. This is when you went to talk about, having that support person. A doula is one of the reasons why we teach clients to advocate for themselves. Even for those partners, I tell my partners or whoever, is supporting our birthing people, all right, they're about to do something. You got to, now is the time, when you need to speak up, and having that extra person and that extra voice, it does something in that room. It shakes it up a bit because they're not used to being questioned.
Right.
They won't, and so there's just been an entire wave of people taking health into their own hands. Years people were birthing at home. Literally, midwives went through, polio or malaria? One of the biggest outbreaks, and kept all their babies alive. The hospital did not.
Right.
So we've been doing it. Historically, Black women have been giving birth at home due to the racial segregation and discrimination in the healthcare system. So we're just going back to what we already know is good.
Which is a good thing. Well, one of the things in 2015, the National Birth Equity Coalition identified this tremendous increase in maternal health outcomes, right? Was it an increase, or was it that we just started noticing? I don't know if you can answer that question, but what do you think? Frankie, I see you on mic quick.
So if you look at the past few years, especially looking at some of the evaluations that have recently been released by the Centers for Disease Control since COVID, there certainly has been, an increase. And we know, and we have known since, COVID entered, our world, that Black communities were the hardest hit. Black and Latinx communities were the hardest hit with this pandemic. And, when it was discovered or released that was the case, the world seemed to care a little bit differently about COVID, right? In terms of the response and the level of sacrifice that people were willing to make when they knew if you were healthy or if you were white or if you were young, that, your chances of surviving this virus, were higher than those of people who look like me. So the past 2 years, definitely the numbers have risen, but the rate of death has been high. But I think that in terms of, reporting these incidents, we have begun to get a lot of more awareness about that. But when you look at during the time of slavery, right? This is my Zoe.
Hi, Zoe.
Of infant mortality, right, were very, very high for us as Black women as well. About 2 years ago, I visited a plantation here, Whitney Plantation. It's a plantation that, well, everyone here probably knows Whitney Plantation.
Yeah.
Thank you, Liz. And I walked through the garden. I think it's called the Garden of Infant Mortality. And I just stood there and I was just overcome with emotions and cry. And I'm thinking, geez, what has changed, right? But when we look at racism in the institution of racism and it, operating under, slavery, right? And then operating under another name now, not a whole lot has changed. So why would the death rate for Black babies birth through Black women, why would that be different, right? So It's just really, it's enraging, it's heartbreaking. But again, the first question you asked was about racism. Yes, racism in its many forms that impacts us because of the inequities in our society, right? And it's all, of course, we know, it's by design.
There's some amazing questions. I mean, I want the participants, all of us are participants, to ask, because there are two great questions, and I'd like, Brooke, where are you? I don't need to read it. I like your voice. Can you hear me?
My camera doesn't seem to work, so.
Okay, but just, what's the question?
So, I didn't want to interrupt anybody, but I wanted to know what, without even the effect of an incident in the hospital or, or some massive, some awful incident outside of the world that traumatizes the Black world, particularly. Rest of us are also, many of us are also traumatized by these things. But has there been much to look at as far as the residual trauma that Black women carry with them at all times, just from the experience of living while Black? What is there any information on that?
Yeah, Joy DeGroot. Talking about the post-traumatic slave syndrome, which is real. I know I talk about it a lot in my work as a doula because I'm really connected to the past, and I believe in understanding your lineage, and I believe in understanding where you were birthed, who, even for both partners, we need to understand how you were birthed, because I recognize in my own birthing experience how my mom had 3 C-sections before me, and so I realized that during my, I was a C-section baby, and one of the reasons is because she was grieving the death of her mother a month before I was born. So understanding that now you're like, oh, I am holding all of her trauma in my womb. We are wound carriers and we're wound warriors, and we hold everything in our womb. And then for the opposite sex, just like those who have, wounds and reproductive system, this is a pelvis. In our pelvic area, we hold all of this. And so we just have to work through that. So even when I talked about the increased number of cortisol, they talk about telomeres and all these different DNA strands that kind of delineate and disappear as we continue to experience trauma. I don't know if you guys read the book called The Body Keeps Score. It's real. Our body holds so much. And if we don't verbalize it, or we're not able to process it with someone, then we begin to have back pain, leg pain, thigh, your hamstrings are tight. And you're like, oh, why I can't bend? Because you're holding trauma. My shoulders are tight because of the weight of the world that we hold. It's so much research being done on, but the research and the actual experience is two different things, because we have a lot of people, which I call and I describe to my doctor, of having walking depression. We walk around every day, you will never know. We smile, we look regular, but there are things in our life that we have to suppress in order to keep moving on. And with suppression comes regression. And also comes resentment, also comes anger. So you have this long line of emotions that begin to happen. And as we began to get older. So.
And Victoria, one of the things is that stuff we keep in is multi-generational. You're not just carrying your mamas, you're carrying your mama's 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 mama. And because it never, it never gets resolved or addressed, because we just keep living as best that we can. But absolutely.
I think about my 3 girls and how they have their grandchildren already in them, right?
Yeah, yes, exactly.
Thank you for that. That's very, I think that's a good thing for everybody to keep in mind.
Absolutely. Thanks for that question. Sweet, where are you? You had a question too. And Valerie, you got to come back and say what you said with your voice.
Okay, I'll wait for Mr. Sweet. Thank you, Ms. Major.
Okay, because he had, Sweet, you had a Raymond?
I didn't really have a question. I'm just commenting. Yeah, please, I was just commenting.
Share.
She was saying that that some of the spaces weren't friendly, and it's beyond the doctor. It's some of the people that you work with. And I'm thinking about Crescent Care, which is where I do my health stuff at. And sometimes it doesn't feel like the most positive place to be. Not all the time, but sometimes it's just not the most positive, not the most responsive space, in town. But it's set up for poor folks. So, went to urgent care the other day, sometime last year to get the COVID shot. Long line of people, or a big line of people. And they come out with this whole line of people still waiting in line or whatever. And then they finally say that they don't have any more shots, or they don't have any more whatever it was. Either a shot or a test, I forget what it was. But, you don't do those types of things to people. You have them waiting. It's I think it was either freezing cold that day or hot. I forget which one it was. But there's certain things that happen in these spaces that just, is almost toxic. And I just, maybe they just need help understanding that just because your space is here, it doesn't mean that your space is really accessible. It doesn't make it really available, even for the people that you say it's for.
Yeah, but we're also asking marginalized people to serve other marginalized people. So it's very difficult for me. I'm being underpaid. I'm 3 cents from getting food stamps, because now I'm working for a clinic. I'm doing a little extra, and I can't access Medicaid anymore. But then you want to work. I mean, it's a lot. It's a lot of different issues. I heard Governor John Bell Edwards talking about, the increase of minimum wage now. But it's like they're already doing it. There are already companies who are paying equitably and paying our people enough. So
we also have to deal with some of that when we have agencies and organizations like that. It's like hurt people. You know what I'm saying? However, those agencies, Raymond, I'm with you. They could do better. I mean, they could do better, because I don't care if it's hiring, it's training, it's whatever. Because all the people that work in those agencies, one, they're absolutely underpaid, because we've got to also remember agencies that serve poor people are treated like the people they serve. So they're never going to be funded properly. The other thing is, I've experienced that in being the director of a clinic, and I never had people wanting to leave, but that has to do with leadership and the fact that people is not always about money either, because folk who understand that they are the same people that they serve. But if you don't have an agency to help folk understand and remember that, then they forget that they are part of the folk that's coming through that door. So agencies have to, it's something else to lay on them. They gotta find money or whatever, but they have a responsibility to me. You know what I'm saying? To make sure that people are respected, that are treated like human beings. Whatever, they may not be able to pay their rent or whatever, then we got to deal with that in that agency. But I ain't cut no slack. You understand? If you sitting at that desk or you working at that agency, then I got to help you remember that the people that come in that door are you. And agencies don't do that. They just go about it systemically like they always do. So there are ways that we can help people remember without throwing them away in terms of how they treat people, and the agency should be held accountable.
Yeah.
There was Valerie. I wanted you to say, Valerie, I wanted you to say what you said.
Okay. I'm proud to say what I'm saying because I know you my big sister. I know you got my back. What it is us as females, period. Then you break it down to Black African American females. We are emotional. We carry extra simply because of our race. Simply because we have a myth that's saying that we females and we are the weaker vessel. Then we take care of the families. Then we got to get a job. We got to teach the children. We got to be an example in the church. We got to be an example in the community. Then when we express ourselves, when we express ourselves, we are responsible for our children. Well, then we got to get 2 jobs and we got to get 3 jobs because we single parents. So we got to feed our child, we got to clothe our child, and we don't want to neglect our children because they want to be in the sports, they want to go to the dance, they want to go to the game. So we got to sacrifice our health. We got to sacrifice our mentality. We got to be straight because if we're not straight, our household gonna go haywire. I don't care if you are married. I don't care. You're still responsible for that household as a female. Then at the same time, it affects us physically. I mean physically. If we cannot exhale it, if we cannot have a Calgon moment to exhale, it will affect us. We have strokes, we have high blood pressure, diabetes, a heart attack because we keeping it in. We trying to be superwoman. We are not super women. We are beautiful African American, and we thank God for our sisters and our other Caucasian white friends. But at the same time, nobody cannot be African American but African American. Simple as that. Just like Dr. Williams said that she, for example, 3 cents short. I lived it. My mama was working a full-time job and a part-time job at night at the truck stop. And she was making a little too much of money because they would only give her $6 to $8 for 5 kids. How can you feed 5 kids off of that? You couldn't do that. So what she did was she worked. My oldest brother worked. And that is very personal. So when someone come and tell us as African American women that we are not respected enough or we are not worth the living cost of wages so we can take care of our child, so we can take care of ourselves, yes, that's personal to me.
It is.
So, Miss Majors, I'm sorry for that. It took me back a minute. So,
no, baby, no. Don't ever apologize for telling the truth. Never, ever, ever. And let me tell you that righteous anger, because one of the things Georgia grew, that righteous anger, when we don't have a way to articulate it or expel it, it'll turn into rage. And that's, I see it all the time in our community. I wanna move to, unless somebody, I wanna move to possibilities and hope and change. Because this isn't start now, because we're talking about, and I see a couple of hands. I see Reverend Manning, I see Belinda, and Shirley, you're gonna have to help me. Reverend Manning, I want to recognize the hands that's up, and then I want to move into, us talking about what can we do? What are some of the things we can do?
And this kind of, first of all, wow. This is deep and heavy and necessarily so. I'm just so grateful for you all and for bringing this polite, and there's so many tiers and levels to this that require such processing. And one of the things I'm thinking is just that, you know, since enslavement, Black folks have just gotten the leftovers, have not been considered worthy enough to get the top notch of anything, just gotten the leftovers. And so Black women have been the recipients of these, just like all the other melanated folks, the recipients of this leftover mentality of not having the privilege of just people remembering that women are different from men, and require so much more care because they are so precious and carry such an incredible gift of motherhood. And that's just from the image that you just made, what y'all presented, of just from the entryway of entering into a facility, to who talks, to what's happened. It's just such an incredible understanding. And I just thank you. But I'm thinking about, as we talk about change, how does the laws that surround maternity leave affect these outcomes, and do we need to work to change these laws? Because, you know, seeing Black women that are in the third trimester still standing on their feet and working, and even if the doctor said you need to have bed rest, but just not having the ability to do that, it just has got to absolutely and rightfully so affect whether this child is going to survive or not. And what can we do, and what is happening now in terms of maternity leave laws being changed?
Frankie?
Dr. Williams, you want, okay. So I think maybe me and Dr. Williams tag team this. So you touch upon a lot of great points, Reverend Manning, and we think about, you know, the development of, you know, things like FMLA, and just over the history of time, over the history of our nation, when, you know, certain benefits were being distributed, and who's traditionally left out of those benefits, that would be, you know, Black people. And when we look at who certain elements of the workforce were comprised of, and that would be of women, Black women, right? Entering into the workforce heavily, more so than white women statistically. And when we look at things like distribution of paid leave systems and the types of jobs that typically come with these types of benefits, statistically, we're not the ones who are holding those types of jobs. As we have advocated for many years for things like a comprehensive, fair and equitable, or just one to start with, right? Overall paid leave system in Louisiana and across the nation, what we hear from the business industry and its lobbyists and certain companies who are supporting these types of groups, we hear that, well, when someone needs something, you know, we want it to be up to the employer. We don't want to mandate. We know what's best. We provide it when it's needed. But when there is not a mandate, we know that the equity is not there. You know, I've heard examples of, well, my accountant was pregnant and we let them work from home. Aside from the fact that work from home is not pregnancy leave, right? It's not. We know that when left to employers to make that decision, there is the possibility of discrimination and inequitable distribution of a resource like this that we all need. Unfortunately, our state does not have a paid leave system in place to make sure that equally people who need to access it and those who need to access it most do. But the good news is that there are several bills that have been introduced this legislative session, one by Representative Sam Jenkins, another by Representative Amy Adato Freeman, that would actually put our state in a place to be able to provide for paid leave. So as advocates for these types of systems, it's important to get engaged with the work of Birthmark Doula Collective, Mama Plus Health Policy Agenda with National Birth Equity Collaborative, iWest, and me supporting them through the Mandla Group to help push forth these types of policies that we know will impact all women, but will have a tremendous impact for Black women. Many of us are leading single households in our state, right? And are sole breadwinners, or a part of two-person households where we have limited resources because of racism, right? So it's just important to know that when we're advocating for these types of things, that we do stand to benefit the most from it, because a lot of times we aren't the ones who can go and take off a year after pregnancy or have someone else provide totally, for our family, because we are, held hostage to some of the lower wage paying jobs where, like someone said, you may be working multiple jobs, or Zoe, or having multiple people in your household who are working, trying to make up a respectable living, decent wage.
So true. I couldn't have said it any better. But something else I was thinking about is that the legislative year from last year, where we were able to get an extension on postpartum care. So parents or birthing people were being dropped at around 6 weeks after giving birth. And so after their 6 weeks appointment, they didn't have any type of follow-up. So now we've extended to, Medicaid is extended to 1 year. And that's pivotal, because a lot of the mortality, maternal morbidities, or the things that happen to, sorry, got a crying. She got her finger stuck. But a lot of them can be remedied by attending a physician, saying, oh, I'm having leg cramps, or, my wound is hurting. And they're able to do that and see them. And then we can mitigate some of the maternal mortality, some of the deaths that are happening amongst our Black and brown people, because now we have an extension when it comes to our Medicaid.
I just want to make sure in terms of time, Arissa, how much time do we have? Because I really want to get to, I got two folk who have their hands up, but I also want to make sure that we're able to address some possibilities of how we can all help.
Yes, Barbara, we don't end to about 6:30.
We good, baby.
Take
okay,
questions. Yeah.
I got it. Okay. Well, Linda, I saw your hand up.
Hey, good evening.
Hey,
wow, this is awesome. It's just very impactful and powerful information. But what I need help with, and I know we're talking about, solutions, I don't know if you are familiar with, since I do a lot of civil and constitutional human rights advocacy work in regards to people being wrongfully convicted. Are you familiar with the word mens rea? Mens rea is MENS.
Mens rea.
Mens rea. Okay, great. What it is that, I'm just listening to you all, and I see this happening a lot where, the state of the mind of a person. And I have found that Louisiana and Mississippi is on the top of the list when it comes to, the mentally and emotionally condition of an individual that would commit a crime. And with mens rea, you cannot be found guilty of a crime if it have been scientifically proven, through all the statistics and everything that's out there in regards to the mental health condition of a person, a stability, cognitive, what I'm trying to say, skills, that you are not in the right state of mind to commit a crime. So what we find is a lot of our, especially young Black men and, you know, some white people too as well, you know, various people that do not have the state of mind to even determine, you know, the ability of, you know, being found, you know, I'm trying to really get this out because it's really bothering me about the fact that when we look through a lot of our cases where the young people have been through school, you know, just like right now, I have a case where a young man is, he's 20 years old and he's on a first grade comprehension level. And they're actually trying to get him to take a plea to something he don't even understand what it's all about. You know, he don't have a clue. So how are we going to deal with that when we see just thousands of people being railroaded through the criminal justice system, and this mental, this man's rear, this part of in order for the prosecution, they have to meet 5 elements. And this is the main element that they have to meet, the mental state of a person before they can actually charge them or find them guilty of a felony crime.
Yeah. Well, Linda, I want to make sure that I don't put our guests in a position to answer questions that, because we had a bunch of questions around the health.
Okay, I just have one.
I know you're a social worker, Victoria, deal with the mental health piece, but I just want to make sure that we stay on topic. We're dealing with this maternal health piece. Go ahead, Victoria.
I have a very, I'm glad she brought that up because I have a very correlating article that I just read about proactive policing and the contribution to the racial gap in preterm births. So they just recently did a study in February, and I can post the article about how those stop and frisk incidents. And interesting enough, New Orleans is about the mayor just recently talked about increasing policing. And so there will be an increase of stop and frisk and though that public policing in New Orleans, where residents in the neighborhoods are experiencing like high levels of this proactive policing, they saw 3 times more likely of birth to be preterm before 34 weeks than their white neighbors. So that's something to think about. And I'm glad that you brought that up because there is a correlation between your birth outcomes and the way that you experience the world. So
absolutely. I want to make sure that we deal with this collaboration between Ochsner and Xavier and this new medical school Lane. But there were 2 hands and I don't want to miss you. I can share later.
We're still in good time. We're at 6:06.
Yeah, I want to make sure that I get, Are you there?
I'm right here.
Yeah.
Good evening, everybody. It's a pleasure to have this conversation. And let's be realistic. It is a colonial mode of production. This is something that's been going on since 1619. We are capital for the system, bottom line. I got a question, and these are my questions. How many doulas are being trained in the community for themselves to undertake our own objectives of morbidity rates and things of that nature? That's one. And again, when you look at the death rate, in St. Louis alone, in the east side, St. Louis, Missouri, in a year's time, you have morbidity deaths that could fill 15 classrooms in a year. So this is all over when you talk about the lack of care for our health. My second question and final question is, are obstetricians and pediatricians on board to begin to construct self-determined programs in the communities where Africans live? We know there's no money. There ain't gonna be no money because when you become self-determined, they tend to want to destroy your project. So those are my two questions, because it's so important for us to begin to address our own issues and not look to some either government or other entity to resolve our issues. They will never do it. Ooh, I'll take my answer. Thank you so much.
Thank you.
Victoria, well, we have I know in New Orleans, we have one of the best doula trainers here this side of the Mississippi. The Midwife Productions is a doula trainer who is training actively and proactively training not only just doulas, but she also has a comparable program called Healthy Birth Ambassadors, which are really focused on the northern side of Louisiana in Shreveport and Monroe. And she recently trained a bunch of them along the state. It's a statewide initiative. So these are healthy birth ambassadors, which are they're not just doulas. They're also lactation consultants. They're childbirth educators. They're advocates for the community, because we know that doulas alone will not fix the problem. But once you have a team of Black professionals who are able to service the community, thinking about rural areas, right? You talked about telehealth. We think about areas that they may not have access to good broadband, who they actually need a person to be able to come into their homes and assist them in, lactation support. Postpartum depression can be alleviated just by having a person there by your side to see you immediately after your birth or during the process. We saw very low levels of postpartum depression for those parents who were able to get a doula in time or before their birth, and even after. Seeking a doula doesn't have to be a home birth. It doesn't have to be all natural. We do C-sections. We are pro-birth, whatever you decide type of profession. And there are some that specialize in, postpartum care, but they're being trained. We have a lot more access in being able to get funding for doulas to be trained, definitely doulas of color. Birthmark Doula Collective is a collective of doulas. So we then offer entrepreneurship, meaning that you are your own independent doula agency or person who provides doula services, and we're able to contract with you to provide services to the community. So you begin to see a lot more wave of those individual entrepreneurs. And then when we just have the Medicaid reimbursement for doula, and we're still working on that bill, but then we'll be able to see a roll in of other doulas who are able to receive Medicaid to service that population of people who are not able to.
Victoria, you mentioned something earlier, which really sticks in my brain. The mortality rate, not only for the baby, but the mother, right?
Yeah.
Due to certain intrusive surgeries, such as the C-section and things of that nature. Mm-hmm. How do you deal with, and this is what we're really facing, lowering those stress levels that I think that Ms. Barbra Major mentioned to the parent, even though we know that the outside circumstances are occurring, the stresses at home, paying the rent, feeding the babies, getting the bread in most cases, right? Having a bed here and there and everywhere, African life. How do you begin to address that? That is an initiative that carries on further than just in that circumstance, with even that parent, and then getting them to get involved as members to help other parents in the community with their stress issues, if at all. I appreciate you. I want to tell you, you all are great leaders. Thank you very much.
And Frank, yeah, to respond to the first one, but also a question you also had on the floor in terms of physicians getting on board with this. Victoria, you or Frankie, I don't know if you wanted to respond to the first question about the training. Victoria seemed to have covered that one. You added something in the chat, but also, are we seeing more physicians and healthcare providers beginning to understand the reality of what Black mamas are dealing with? That was kind of the question. I didn't want to reshape it. But
your shaping is right on point. Go ahead.
Yeah.
Yeah, there are so many great questions that Mr. Oshosi.
You could just call me Sayero. I've been called many things though. So.
Sayero. I will call you Sayero. Thank you very much.
Thank you all very much.
Absolutely. You asked so many great questions. One, I'll start with the last, but I want to go back and have a chance to respond to about the stress and mitigating that stress. So yes, there are physicians who are getting on board. The past few years, we've seen an increase in things like implicit bias training. There's been hospital institutions, private practices that have been accepting and have enrolled in various products that are available through organizations like Birthmark Doula Collective, National Birth Equity Collaborative, and March of Dimes. I know 3 organizations that have some form of grand rounds or implicit bias type, training. So that has been received fairly well in terms of accepting and implementing it are two different things and a level of accountability. But I think that the level of awareness of physicians, is there, and there's been a response to that. I want to go back to your comment about just the stressors and mitigating that and just the daily stressors of life. I talk a lot about that when I, talk about this thing called weathering, right? Which I put in the chat. There's research that's been done on that for decades. It's basically the premature aging of, birthing people's bodies, before you even have a child, right? And for Black women and Black birthing people, it seems to have more of an impact on us because, things like that due to systemic and structural racism, it's, targeted towards us, right? Trying to survive in this world of inequity, right? But in terms of opportunities to help birthing people mitigate stressors, that's where a few things come in, right? Education comes in first to understand that threat is there, right? And that is one of the things that you should be aware of to find ways to find balance and seek whatever is needed to help you through that time, right? Outside of what many of us are aware of, what some of us can expect in the medical institution. I hear a lot of moms talk about, and partners and dads, oh, I'm going in there and I'm going to advocate for myself, or I'm going to be on top of it for my wife. And just to even have to even go through that, is really a sad day to not anticipate your birthing experience, your pregnancy, and your day that you give birth to be one that will be held sacred is a travesty in itself. To have to go in there with your guard up as a mechanism of survival is stressful. That you find out you're pregnant, and this is something that you may have wanted for a long time or for a short time, then all of a sudden it's like, well, I hope I survive. Like, I've heard that one too many times. One was enough, but I hear it very often, and it's heartbreaking. But I think the medical team, like I said before, about being culturally competent, understanding some of those stressors. There are social screeners that medical providers can give to the patients, right, that would allow them to get a better glimpse of what that pregnant person may be going through. Again, Dr. Fleta Mass-Jackson, a Black researcher and scholar, she's designed a social screeners that is being used in some medical settings that can help that medical provider know, what that person is experiencing, to perhaps tailor a course of care to help them, right, to support them through what life may offer. But then also the birth work team, doula, midwives, right? The midwifery model of care is different than the obstetrics, the OBGYN model of care, right? It sees pregnancy as a natural occurrence and not as, something that, requires, medical intervention. The way that treatment is provided, or that support is provided, they're able to spend more time with the patient. And, the mental health aspect, perhaps maybe more a part of that course of, care, and centralized perhaps in the appointment, but just understanding that these threats are there and that pregnancy is not a time to do XYZ, right? And I'm the one to tell you, when I was pregnant with my daughter, my second child, who you saw a little while ago, she was born 3 months early. And one thing I know from that pregnancy versus the first is that I was under a lot of long-term chronic, like won't let up abnormal stress, right? And I wish I'd had a doula from the time that I found out I was pregnant, because a few months before I found out I was pregnant, I screened positive for depression. And I really didn't really have an opportunity in my timeline to really seek the support that I needed that could have maybe provided some better outcomes. But I know that I would have given anything if earlier on in my pregnancy, in hindsight, if I'd had Victoria as my doula, right? To help me, balance and find that balance and just kind of work through, understand, certain things about how that elevated stress level was, sending cortisol throughout my body and, just doing things that could impact my, health of my placenta, right? And then the health of the placenta determining the oxygen level that your child gets and their nutrition, right? And being able to sustain and nurture and grow my child, right? So there's so many things that stress takes away from your pregnancy. And so I like to start with education, knowing that, and then you have the medical team too, that has an onus to educate and to treat accordingly based upon that person's need. And I see Victoria put some of the bills in the chat. So thank you for that, because I was getting ready to drop the link to the Mama Plus agenda in the chat. So it was wonderful.
And I'll ask Arissa, I don't know if it's you or Pastor Manning, can those bills be put in a newsletter so folk can get
it? Absolutely. Yes, absolutely.
And just a disclaimer, it's not a comprehensive list. This is like the bills that our organizations focus on. And so, of course, there are a couple that we have some red flags on, and then we have a couple that we're in the yellow around. But these that we have, we definitely support as an organization.
And
in the same way, I'm just real quick, Ms. Barbara, are there bills that we need to oppose that would have a negative effect that we need to be aware of?
Can you get those to us, the ones that we need to say, make sure our folk know that we're not supporting those? And
okay. Frankie,
you're on the list too. Yeah, this list has bills to oppose. Again, it's not a comprehensive list, but there's some of the main ones. There are some abortion-related bills to oppose that are not on here. So we can certainly get those to Brooke to get disseminated as well.
Great. Just you all, because you know this more than we do, and you're here because we trust you. And so if you could just to keep us education, just say that, Frankie, educate us to the ones that we should, beam in on, and both in terms of support and the others in terms of how do we slash it. Lane, you had your hand up, and I appreciate your patience because it's been up a while.
Thank you. I asked the question earlier about how the trend in the last 30 years to using more C-sections, which is predominantly, as I understand it, and I'd love to hear from both of you, Dr. Williams and Ms. Robertson. I understand this because of doctor hospital billing preferences, because they can bill more for those procedures, and because of the doctor convenience, practice convenience. Oh, I can plan my hospital visits and the births that I'm going to handle if I have them all scheduled by on surgical schedules for C-sections. So has that figured into the unequal outcomes in the health for Black and brown women? Thank you.
I'll just start by saying that the obstetric system are trained, that obstetric people, practitioners are trained surgeons. Okay. So they don't spend a lot of time giving birth. They prefer to be in surgery. But to that avail, there are some that are more convenient. They always do that thing around the fear monger. They're going to fear us to death. You're at 2%. You 2% chance of hemorrhaging. Your baby's too big. Your baby's small. When historically we know babies of all types, breech, twins, everything have come through the canal, and so. It's unfortunate that we've been pushed for more C-sections, and they've gone up tremendously. You're right, definitely for Black and brown people. I don't know if it's because of the fear that they could pay, but surgery is just as detrimental as, like my grandma used to say, you 1 foot in the grave already. So like we already know that giving birth, you're on the edge. You're on that line. You're towing the line between life and death. And so to add another layer of a knife, removing severance, cutting through 7 layers of skin, seems like a lot. I was also feared into 3 C-sections because technically when you have one, you kind of stuck. But there are a lot of people who do what they call VBACs, which is vaginal birth after cesarean. And so we now have a wave of those individuals. But if you are around and that's more, still risky. People are still scared of it. There are not a lot of practitioners in New Orleans who are able to perform VBACs. I think it's like 1 maybe. And then you will see that wave of those who've had a C-section who then move on to home birth for the second birthing experience.
I'd like to answer that too. Of course, Victoria's response is spot on. You know, this is a really touchy, frustrating subject for me. Like when you asked that question, I was hoping we would get to that about that. So this is a binder that I have, like on my bookcase. This was a binder through my work as a maternal child health leader way back in 2012. It's called Elimination of Non-Medically Indicated Elective Deliveries Before 39 Weeks Gestational Age. We know that a full-term pregnancy is considered 37 weeks plus, but we know that between 37 and 39 weeks, there's critical, the baby may survive under, you know, certain circumstances because they're full term, but the brain is still developing as one of the main organs, and other key organs are still developing at that time. And you're absolutely right. Like Dr. Williams said, you know, it's a convenience thing. There were hospitals that pledged not to do this. And for a while, it seemed like it was working. But 11 years later, we're back, it seems like, where we started, where physicians have found a way around, right, being able to record the need. Baby too big, baby too small. And like Dr. Williams said, babies of all sizes and singletons, multiples have come through that canal with no problems. You know, a lot of what I'm hearing now is like, you know, as Black women, you know, I know for me, I had gestational diabetes with both of my pregnancies, and I'll hear people say, well, my doctor said because I have gestational diabetes, I need to do this at a certain time. You hear some of everything, right? Baby's too big. Maybe baby might be too big. Maybe this, maybe that. In my case, my C-section was warranted. I had hypertension. My child was not responding. You know, when she was born, she needed medical intervention, blood sugar drop, like all sorts of things. It was touch and go for a week. We tried to keep her in, and it was medically necessary for her to come out because we didn't know what was going on with her because she was not getting proper nutrients, because it turns out my placenta had some abnormalities, right? So it wasn't really healthy because of the hypertension, right? But it seems like, you know, pregnancy, childbirth is kind of turned into this drive-through thing. We know that capitalism is just basically ruling just about everything in America. And it's like, how quickly can you get this done? Like you said, can I schedule this so I can go on my vacation? Can I schedule this so that I can get more patients? So it's not even just about the increased rate, right? It's about convenience. It's about finding a way of efficiency. So, I mean, we know it's not efficient. I'm just saying, like on paper, right? But it's also, you have to value that person and their birthing experience. So if you don't value that person coming in and their birthing experience, yeah, let's rush it, right? Let's get some Pitocin in there. Let's speed this up. But then when you have people who are doing elective surgeries before it's time, inducing people, and that baby is not ready to come out, you can do whatever you want to, you know, give the medication, try to ripen the cervix. If it's not time, baby's not coming. And then that's how you end up with a C-section as well, right? So there's all sorts of ways we find ourselves with this rate. But again, trying to make pregnancy a medical condition that's a drive-through experience that needs to have surgery and make it convenient. Babies come when they want to come, right? So that is a part of the problem, trying to automate this and trying to make it convenient. that's what we're seeing with these numbers. Yeah, there's medical conditions, there's hypertension, there's needing to prevent an episode of eclampsia to save lives, but we're not at higher than 30% because of preeclampsia. That's not right.
Are you all involved in the either one of you, and hopefully both of you, in the Xavier Ochsner collaboration for a medical school?
No, I mean, I have a professor friend who works at Xavier, and we had discussion about it, but I know that it's happening. But Ochsner kind of got their hands in everything. I was explaining to Brooke that I recently talked to the midwife program at Loyola, the director of the midwife program at Loyola, and she was saying how Ochsner has now allowed them to do their clinicals there, but also their nursing program has an incentive for those people who decide to go into nursing, and then it's almost like $10,000 for you to come work with us later on. So I don't think it's a bad thing. I think that it's important that we're turning out more Black and brown providers, but I'm just not really sure where Ochsner stands.
Yeah, I hear you. Keep that uncertainty. I'll just put it like that and leave it alone. Go ahead, Frankie. You wanted to, are you part of that? I guess
I'm not familiar.
Yeah, the concern is you can keep creating, but we keep creating the same thing. You know what I'm saying? So I'm excited about this. I got the opportunity. We can see more Black and brown people and other people of color really get into the medical field. However, who said it? Like, just because you got my skin don't mean you my kin. If white institutions are controlling the narrative, the direction, the priorities, then what difference can I expect, I guess? And are you a part of it? Then I'll feel better that somebody's going to be saying something.
Yeah, and those are such great points, because you have organizations like the National Birth Equity Collaborative. I remember years ago, Dr. Joya Creer-Perry talking about, and Carmen Green working with certain like medical societies, like trying to disrupt the training curriculum, right? Yeah. Because as we're working to talk about or address implicit and explicit bias, you've got so many medical students coming out every day with that same racist narrative baked into their education, right? So yeah, you can train a doctor and have them do something to, continuing education credit hours for them in their office, but then you still got the students coming out each day, being taught certain things that are clearly, that are biased. But then just backing it up a step further, oh no, I can't eat that right now, but thank you, I'll save it. I will. You have, elected officials like, Ron DeSantis and others who are trying to create, this false narrative by hiding, the history of our country. So we really have to start with K through 12 to teach proper American history and how these social disparities came to be in the first place, to interrupt prejudices and biases that people have against people of color, and the narratives that, different media institutions and others are putting out there to help fuel the fire and the divisiveness in terms of people regard for us as Black people, right? And understanding how these inequities started. But we have to start teaching that. Like, both of my kids are signed up for Black history through a gentleman by the name of Ernest Krem III. I'll give him a plug, critical race theory for K through 12. And they're in that class every Sunday, right? Alongside Black children, white children, parents, and everybody. So that is important. So we have people who, as adults, we're not trying to fix things, right? And we're not trying to fix doctors coming in with biases. We're not trying to fix people who are writing the medical textbooks that have to be undone. You attack it at its core, right? Again, because it's all of these systems that are contributing to poor maternal health outcomes for us as Black and brown people. It doesn't start in the doctor's office. It starts throughout the life course, right? So it's a very complex system, but dismantling it is doable.
Absolutely.
Right. I think what's hard for me is that everywhere we look, from education to the grocery store, we're being told that we don't matter. And so that's very hard as a mother of 3 girls to see and to understand. And so how do we as parents or as birthing people, as grandparents, because we're all actually responsible. There's not one person on this call or outside of this call who's responsible. We all are. We all are responsible for the health and well-being of all people. And so how can we make sure that what we're doing is providing empathy, showing empathy, understanding how to be empathetic, being culturally having cultural humility, and understanding that like every race, every person is different. We have to get back to the fundamentals, and we are all capable of doing that.
I just I guess one of the things I'm always, I don't know who's, one of the things in terms of closing it out, it is hope. What I hear from you is that we have to have a multifaceted approach to this. I mean, whether I do work with hospitals, and there's like the largest FQHC in the country, working with all of their clinics in New York. And they're doing a clinic at a time. How do we go in and really, one, deal with the fact that we have these racial disparities? So is there a way though, because you all have the whole issue around optional, you may not, that you have to start, pre-K on up. But if we're creating anything to train anybody, that we not introduce, or they should say up front that they're going to do it different than it's been done before, that they recognize the fact that racism is embedded within the healthcare system at every level. So, and I don't care, Xavier Black, don't matter to me. Xavier go in, Ochsner run things like they always do. Ochsner have the money. Let's just say, Ochsner got the juice. Legislative, they always had. However, Xavier has the power, and if it's supported by the community to say, we want a different kind of training here in terms of the healthcare providers you're going to be producing. We don't want the same thing we've had before. Is there something that we can do? We have the bills, because that was part of it, something that we can do as an organization, as community, but I don't want to leave Ochsner and Xavier alone out there by themselves. You know what I'm saying? We're too easily manipulated, even if we some big old great Black institution. And I just wanted to say earlier, this weathering, that blew my mind. Weathering really means that Black is starting to crack. You know what I'm saying? We used to say Black don't crack. Weathering means that all these stresses are aging us. And I mean, it's having a serious impact. So just in terms of some things we can do.
About that with her Black joy, and how, like you said, weathering, we're losing our joy. We're no longer.
We really are. Yeah. And we're losing our good looks. That's what give me joy. That's all I'm saying. But it's like, so some of the things that you all have said that we can do is there anything else to support these bills that you put out there? And some of them around the things that we've already been thinking about, like expand Medicaid, you know what I'm saying, to cover, I love to really pay doulas for real. I mean, pay people, because that's such a valuable asset. Anything else, cash transfer. I mean, anything else that you would like to say to this organization to support the work that you're doing?
I would like to add something that I just put in the chat.
Oh, okay. I'm sorry, Brooke, I didn't see it.
That's okay.
Go ahead.
I put something in the chat suggesting that maybe people would like to sign on to a group of letters that we would send out to some of these legislators, that we would send out to people. So please, if you are interested in doing that, we will, people at Justice and Beyond tomorrow during our meeting, will put together a letter that then we can send out and add your names as supporters in this. So if you're interested in doing that, please throw your name quickly into the chat before we end, and we'll get this rolling, and maybe this will start something else to happen too. So
that'd be great.
I think when I think about it, I saw Miss Betty's sign Ubuntu. I am because we are, and I think that is how we come together. Right. Understanding that I am because we are, and if we're not all together and we're not all one, then I'm nothing. I'm nothing without community. I'm nothing without the power of the people behind me. So if our allies can truly be allies and step into spaces where we are not allowed or where our voices don't matter and speak on our behalf and really say to people, Black birth matters. I got t-shirts, and support small organizations who are trying our best, right? We doing this thing on a shoestring budget. I don't even know if Frankie pay herself. She probably don't even pay herself, but she's understanding that, this work is more important than the dollars in our pocket, but I didn't take a vow of poverty to be a social worker or an advocate. I want to be paid. I want to do the work, it. And I want my people to be free and feel freedom beyond their mind, beyond their own imaginations. I want them to be free. And freedom looks like being able to birth the way that they want to birth. And it looks like our initiative, our policy-focused initiative that addresses this emergency. And until they call it an emergency, because with an emergency we pull into action, we'll never get anywhere.
I want to thank you. Yeah, I'm sorry. I just want to make sure that we thank you, not just for being here, but for what you're doing and your cohorts wherever you are. And what I hear this organization saying is, how can we help you do what you do? And you just said it. We need you there. We need you in the spaces. Brooke said, writing the letters, whatever you think else. We can't do everything. We know that, but there are spaces that we can be and voices that can be lifted to help support your work. So I don't know if there's anything else, but I'm sure folk are going to be wanting to talk to y'all again. It's on you, Pastor.
I'm sure, ladies, if you put you'll be wanting to give us your contact information in the chat for those who continue to have questions. If they want to get a hold of you, thank you. I'm not sure where my heart is right now. It's just, it's full, it's overwhelmed, it's heavy, it's has a righteous indignation, all of that. And so I just thank you. I think that I'm thankful for the people that attended this discussion tonight, those who are here in this space and those who are on Facebook. And for those who are going to listen, because education is the key. And I'm reminded of Dr. King's words that injustice anywhere is a threat to justice everywhere. And we continue to celebrate the strides that we're making and continue to pray and be hopeful that we'll make more strides and be mindful of the fact that when we're dealing with racism, we're dealing with an intentional system that is beset upon subjugation. And so we've seen this since man walked the earth, that there's been this plot to subjugate those who are melanin complexities. And so we're in that place now. If we can just kill off the babies, they will become less powerful. That's biblical. We see that in scripture. That's all. I just want to say thank you for being here. Thank you for what you do and what you continue to do. And thank you for just being mothers and for setting an example. And thank you for all the mothers that are attending here tonight and for just spreading the word. And Ms. Barbara, as always, thank you. I love you and just so grateful that you been a part of this conversation tonight. I can't think of a better person to lead this discussion. Thank you so much.
Much love, everybody.
I'm going to tell those young ladies that you all are very powerful. And I'm going to thank you for who you are. All right. Well, and how you stand.
Absolutely. All right. So we're going to go ahead and close. Again, thank you, Dr. Williams. Thank you, Ms. Frankie, for being here. And we look forward to seeing more of you as we come back to this discussion at another time and continue to speak truth to power and educate people. So as we, someone's phone, if you could, mute it, please. There's some distraction noise in the back, so go ahead and mute your phone. We're going to move to some announcements. We want to uplift anything any events in the city of New Orleans that are going on so that we can show up, make our voices known. And so if there are any announcements about any events that we need to be made aware of, please make those known at this time. Any announcements anybody has?
Oh, I've got an announcement. You know that indictments came down on the African People's Socialist Party 2 weeks ago. We're being charged with conspiring with Russians to offset American elections, which is a lie. It's a self-determined organization, as we're speaking tonight on self-determination. And right now they want to lock the chairman, Omali Yesatella, up, who is 81 years old, which would produce a death sentence. We're asking everybody, I'm going to put it in the chat, to study more of this. I don't be so long-winded. Go to handsoffuhuru.org, join in. You can lend your talents, your gifts, as we all need to do, as I mentioned today, that we need to do with each other, one another, because we're in this thing together, and all of our necks on the chopping block. Uhuru.
Thank you so much for that. Thank you. Thank you. Anyone else? Any other announcements?
Yes, I have an announcement. District C community meeting will be April the 24th at 6 o'clock through 8 at Alex M. Charter School. That's on Berkeley Drive in New Orleans. And also, anytime that we hear about the city councilman or any local official that's having a health meeting, public meeting, it is very important for someone to show up at the meetings and voice our concerns. Voice our concerns about the females' productive system. Voice our concerns about the mental health of the Black African-American community. Voice our concerns. That's how we'll get our voice heard. That's how we'll keep it on, I'm gonna say, our politicians' mind, and let them know this is not no silent matter. We are not in the basement. We are not in the backyard, but we are out front. When we keep this up front, guess what? When they see us coming, they already know what the topic gonna be. Thank you.
Thank you, Valerie. Anyone else? Any other announcements?
I just wanted to remind everybody there's an election on Saturday for criminal court judge, and last election we had like 10% turnout. We can do better than that.
Absolutely. Show up to vote, encourage, and when you show up to vote, take about 10 other people with you to make phone calls. We must participate in this voting process and in our democracy. Thank you for that, Arissa. Anyone else? All right, hearing none. Valerie, would you do us the honor of closing us in prayer?
Yes, sir.
Thank you.
Every mind be at peace. Our gracious Father in heaven, we come into you for we recognize that you are Lord of Lords and you are King of Kings. You have everything and everybody in your control. You allow things to happen for a reason. We are asking you, Lord God, to step in and strengthen your soldiers, strengthen your child to be a voice in the wilderness, be a voice of wisdom, be a voice of power, speaking the truth, acting on the truth, and living the truth. We are asking, Lord God, that you place someone in a position that people will be recognized, people will be respected. Doesn't matter the color we are. At this time, we are speaking loud and clear for the African American females. We are speaking loud and clear in the communities, in the neighborhood, in the cities, in the towns, that we have a voice to be heard, and our voice will be recognized, and our issues and our concerns will be respected, and will be counted among men and women as human beings that created by you. We thank you, Lord God, for hearing our voice. We thank you, Lord God, for coming to our rescue, protecting us and providing for us. We be careful to give you all the glory and give you all the praise. We thank you, Lord God, for the soldiers, Lord God, who's speaking up tonight in behalf of females, in behalf of our health, in behalf of our maternity. We thank you, we glorify you, we magnify you. In Jesus' mighty name we pray. Amen.
Amen. Thank you, Valerie. Thank you all. God bless y'all. Be kind to one another, compassionate, empathetic, and believe always that we can make a change, and we are world changers, and we stay hopeful. God bless you all. We'll see you next week.
Good night, y'all.
Good night, Val.
Good night.
Good night, everyone. Thank you so much. Hi, Lane. You're muted.
Is that your new screen that did that to you, that lost your camera?
I don't know where it is. And I have a camera, so it's not that. I've tried every conceivable combination of things.
Oh, Beth, are you still on? You're muted. Beth Butler?
I can't tell who's on either.
I see two other people. Maat Anaktat, probably, and then Beth Butler. Anyway, it was a really good forum.
There are 5 of us, I think.
Oh, okay.
At least that's what mine says.
Well, we'll have a lot to talk about tomorrow.
Yes. Goodbye, all.
Shall we, since I have you for one more minute or 30 seconds, shall we try to draft? I think I can probably draft something just as a first of a letter for us to send out, and to send people, so that not only could we add their names, but so that we can. And frankly, I don't know. I think maybe we should think about sending it to the entire membership, for them to either send themselves, or to simply let us know that they want to add their name.
I guess they don't usually respond. I mean, if you look at the number of people who actually open the newsletter, things like that. But we could try. I think.
Maybe we could post a link to it in PDF.
That's what I keep thinking. We should be able to do that. I don't. We can ask.
Yeah, we can ask me or Liz, if Liz knows how to do it. Okie dokie. I'm going to sign off.
All right. Thank you again so much for all your help. Your undying, unwavering assistance in this. But I think it was good.
I fell asleep last night. I'm so sorry.
Oh, no, it's fine. It all worked out fine.
It did. Okay, my dear.
All right. Bye-bye.
Bye-bye.